By definition, it's a chronic problem, otherwise known as chronic rhinosinusitis. I will also perform a nasal endoscopy to examine the inside of the nose to see if I can find any polyps. Many of my patients come and see me because they have breathing difficulties through their nose. Now, this could be due to them having a septal deviation, so a deviated nasal septum, but something I perhaps haven't addressed so much is the presence of nasal polyps or sinusitis. Now, many patients will present with a reduction in their sense of smell, congestion in their nose, they may have a drippy nose or mucus buildup. Often I manage these patients without any form of surgery. Nasal steroids typically are the go-to, along with washes, saltwater washes in the nose. And we find during winter time, symptoms can become more pronounced. Now, if these symptoms are lasting longer than, say, 12 weeks or so, by definition, it's a chronic problem, otherwise known as chronic rhinosinusitis. If the nasal steroids are not working, the nasal douches are not working, I may recommend a scan to try and find out what's going on with the sinuses, which are these air pockets within the facial skeleton. I will also perform a nasal endoscopy to examine the inside of the nose to see if I can find any polyps. And ultimately, if all the medications have failed, then I may perform endoscopic sinus surgery, or otherwise known as functional endoscopic sinus surgery. This is keyhole surgery carried out through the nose to reduce the nasal polyps in the nose or debulk them altogether. But in addition, I would clear all of the sinuses, open up their natural drainage pathways to allow better delivery of medications so that patients can breathe better through their nose. We know then patients who have asthma, there is an association with nasal polyps. So improving patients' nasal airflow can actually improve many of their other underlying health conditions like asthma. But it's important to understand that surgery is only one part of the journey. Ultimately, patients will still need long-term intranasal medications in order to have a better quality of life.